Okay, welcome family. This is B.L. Carter here, affectionately known as Miss B, here with part 2 of the symptoms of people with un- or undertreated hypothyroidism. The first part you can see already, and we're going into part 2. Just quick housekeeping. Remember, I am not a doctor, and this information should not replace your medical team. Use it as a guide to help you do your research, and keep researching, and don't stop until everything feels okay. So let's dig right on in. The next area we need to look at is our hair and skin. So people with poorly treated, untreated, or undertreated hypothyroid issues will have no eyebrows, or their outer eyebrows will thin. The hair tends to become dry, broken, or brittle. It'll break fast. A lot of hair loss. You may even have hair growth, but it's so weak that it breaks fast. So it's not like it's really growing, or not sustaining. It's growing, but you can't sustain the growth. A lot of dandruff, dry skin, which is basically what dandruff is. Dry cracking heels of your feet. Overall dry and itchy skin. And as you see, I have a picture here of skin looking like scaly, which comes from the swelling. Once you've swollen the fluid, once the swelling goes down a little bit, your skin kind of has that scaly little look to it. Kind of reminds me of a lot of times when you visit people in the hospital, they have that scaly look on their legs and stuff. Another symptom, pimples and or acne. I just mentioned this, a lot of swelling, edema, puffiness, and maybe in the arms, in the hands, definitely in the legs and feet. That's something I struggled with. And honestly, even though I got what was close to optimal, the swelling, I could get it down tremendously, but my swelling never went away. So that's something I deal with on a regular basis. And the quickness with which I swell, or the level to which my legs do swell, is one indicator for me personally to know when my levels are getting off, or if I've not been eating properly, or something that's throwing my levels off. So, as I said in the first video, in part 1, over a period of time, even once you begin to get your levels more optimal, or more moderate, if you will begin to learn the symptoms that will be your first signs that something is wrong. Because you can just get pneumonia or the flu or bronchitis or something and have to take an antibiotic. And that antibiotic can throw you back into a little loop. And next thing you know, your regular hypothyroid treatment is not working. Until, you get rid of all that medicine out of your system, or you may have to adjust your treatments for the time frame that you're having to deal with this other medical issue. So, the breakouts, even to the point of hives, neuropathy, which is nerve issues, and I experienced that. My legs took a real strong hit, if you will, in the process. So I do have some nerve issues in my legs, both legs actually. And vitiligo. I remember when Michael Jackson his skin started lightening up, and we were saying he was bleaching himself. Vitiligo is when your skin begins to lighten and lighten and lighten. It's a loss of the melanin. And supposedly what he was doing was bleaching to even it out so it would be all one color instead of having the splotches here and there. Vitiligo itself is an autoimmune condition, if you will. And then the brain. just difficulty or inability, depending on how bad it is, to concentrate. Just trying to stay focused becomes an issue. That's why in part 1 I mentioned about reading and studying. It's very hard to do that because you just can't concentrate. Difficulty / inability to read for a long period of time. And you have trouble retaining what you're reading. How I overcame that was I just started doing audiobooks, or a lot of audio or visual as much as possible. So that helped me to reduce the amount of processing, if you will, that my brain needed to do from reading. If I got it audio, my brain was still able to process it a lot quicker than the lag from reading. And you will learn these as you're dealing with it until you're able to get your levels optimal. You will learn how to modify, daily life to get you over the hump, so to speak, until you get to an optimal state. But forgetfulness, yes, foggy thinking, memory issues, hard to remember stuff. It's like stuff just slips away. And I have a picture of the brain here just because it's important, I think, for you all to see the all of those symptoms that are listed up there pretty much fall into every single lobe of the brain. So there is no part of your brain that is not impacted if you have un- or untreated hypothyroid symptoms or undertreated. From the visual processing, I think I mentioned before, the eyes. In one of the series, your eyes do get, your vision does get affected. Just all the way around, you can, look at those and see. So in the head area, dry eye syndrome, that's where your eyes just become dry. They just stay dry. It almost feels like you have trash in your eye, but it's not trash. They're just so dry and you're rubbing them a lot. Some people use Visine. Some people use, at one point I remember putting tap water when it first started for me. And then I was able to get with, I think there are 2 or 3 specialists in the country, in the United States, that deal with the eyes as it pertains to thyroid problems. And so I was able to get the funds together because my insurance didn't cover it. And see one, actually I saw 2, one on the East Coast and one on the West Coast. And the one on the West Coast, he's like the number 1, and was able to get some good information and some good instructions from him, as well as a prescription for what he recommended to keep my eyes moisturized until I was able to keep my levels and get my levels back to optimum. But I don't recommend using Visine or any other over-the-counter drops. It's my understanding that you could do more damage to your eyes long-term using those. So if you're having that issue, you definitely want to see an ophthalmologist, not an optometrist, but an ophthalmologist, to make sure all the appropriate testing is being done for your eyes, and they can prescribe something that's going to help, what's the word I want to say? Look, I'm drawing a blank right now. To help moisten your eyes and help alleviate some of those symptoms. But vision tends to get worse. I know I've mentioned this before in one of the videos. Your vision may actually, one thing I encountered was the actual muscles and nerves were changing the angle to which my eyeballs themselves were actually positioned. But then I started experiencing actual change of vision itself. And so, but it changed back again once my levels changed. So that's something that you'll have to deal with. Headaches and migraines, slurred speech, the swollen tongue, decreased articulation, in that especially if you're a person who articulated very well, you're an orator, That's something that, you'll struggle with. And, you may even find yourself not speaking in front of people for a while just because your speech is not what it used to be. But again, once your levels kind of get a little bit closer to optimal, a lot of that will come back. Doesn't always come back to what it was before, but it does come back enough to where, you can function. That lowered, deepened, raspy voice. I know I did a separate video on this one specifically, because I'd heard a lot of people talking about women and the deep voices and stuff, and, oh, she sounds like a man, or she sounds like she's asleep, or, kind of ragging out on the women's voices and stuff. And there's definitely a medical connection to it, and people don't realize that. But the dry mouth, something I experienced. The gum problems, gingivitis, and whatever the other gum diseases are, you may experience those. You may also experience where the gum is receding or loosening, and the tooth is loosening away from the gum itself. Internal itching or ringing in the ears, definitely an issue. Hearing problems, I experienced that. I lost a significant level of hearing in both ears. It restored a little bit, never restored back to what it was, but it restored pretty decent, if you will. I still do have to ask people to repeat themselves and stuff, but I've learned to manage with it. That's something that didn't come back, if you will. Dizziness from fluid on the inner ear. You definitely experienced that, as well as the puffy face and the puffy eyelids. So, this guy's no joke. He can really do he can kind of take you for a loop, if you will. And the hands, the puffy fingers and hands, that's the swelling, that's the edema, that's the fluid that's swelling up. Your fingers tend to be a little stiffer. That's the inflammation. That's in your fingers. It might be in your hands. It might be, just anywhere throughout your body. You have a lot of inflammation. And I just went out of order, but I was just, as I was typing this, I was just kind of going down the list and kind of doing a dump, if you will. Breaking and brittle fingernails, broken or peeling fingernails, or ridged nails. Now, I have the ridged nails. My nails will grow. But they will also break off, but they tend to stay. I didn't have the broken fingernails for an extended period of time, or not so much of it, just I think because I also still have the hyper working in my body in addition to the hypo. So my nails would grow, and they tend to get a little weaker when my levels are off and I'm falling in the hypo more. But they don't usually break off down to the point where you see this picture here. The tendinitis, carpal tunnel pains. You may be diagnosed with carpal tunnel, but oftentimes doctors won't diagnose you with carpal tunnel, but you have the symptoms just as if you have carpal tunnel. But again, once you get on the right medicine and the right treatment plan, your levels start to level out, then the carpal tunnel symptoms kind of fade away to where they're very intermittent, maybe, periodically. If you, like I said, took a different medicine, or if you by chance missed your meds for 2 or 3 days, for, let's say, if you went away for the weekend and you forgot your medicine, then you may experience some of these symptoms at a very, very, very low level. But if you get right back on track within a couple of days, it'll go away. So the wrist and palm pain, again, that goes along with the carpal tunnel. All of that, your arm, your palm, your hand, the nerves up and down in your fingers, all of that will just hurt. Bones, muscles, and joints. Oh yeah, this guy, this one's something. So you tend to just ache. Your bones and muscles ache in your body, in your legs, your arms, everywhere. Joint pain, the clicking and popping in your joints. Joint stiffness. to where, just even trying to walk becomes very challenging. You already have, like in my case, I had the neuropathies going on. And then I had the swelling. I had the pain. I haven't gotten to the foot yet, but I had pain on my feet. And then on top of that, I've got this stiffness and inflammation in my legs. My legs took it hard. Doctors may actually diagnose you with fibromyalgia, which is where you just hurt everywhere. Just even the slightest touch will cause you to hurt. Someone just brushing up against gently on your hand gives a signal of pain instead of just a signal of a brush of the hand. Osteoporosis is where, your bones are weakening. You're subject to fracture very quickly. That's why the falling from the vertigo or the dizziness is very important to watch, because your bones are tending to get weak. And if the vertigo or the dizziness causes you to fall, then you're subject to break a hip. In my case, I, fractured my foot. But, those are things that kind of go along with the territory. You just want to be mindful. Muscular weakness, inactivities. I mentioned carpal tunnel under the hands. Back pain. Lower back, mid back, upper back, just back pain in various areas. Sometimes it can be excruciating. Sometimes it's just an achy kind of pain, a pain that just I'd say maybe a level 6 or 7, maybe on a scale of 1 to 10, but then it's a constant. It won't go away. Shoulder pain, as well as knee pains. Now let's talk about weight. A person who's hypo and stays hypo for a period of time has trouble losing weight. You can try every diet in the book. You can starve yourself. You can do whatever. You run 100 miles and you're not losing anything. If you do lose, it's just the water weight. So you're just going to be gaining weight. Sometimes it leads to obesity. I know we've seen a lot of people who are almost morbidly obese, and oftentimes they have thyroid problems. You have that fat tummy. Everything else could be proportioned and in place, but that fat just sits right there in the stomach area. And again, I mentioned the fluid retention, the edema. Now, the interpersonal stuff. Your relationships or work. You have difficulty in all relationships. Just because you tend to be a little bit more agitated, and most people don't understand that, and they won't take time to understand it. If you're not warm and fuzzy, bright-eyed and bushy-tailed and bubbly at all times, then the assumption is something wrong with you, and so relationships tend to sour. There may be a decrease in your sex drive. You may be argumentative, and it's not so much that you want to argue, but you're just, not necessarily feeling well. So, you're kind of crabby, you're irritable, and but it can also be due to the cortisol from the adrenals being low. You will avoid a lot of things, a lot of people in this extended hypo state. You won't be able to work full time. You won't be able to work full time, and I think if you see all these symptoms here, you see already you won't be able to work full time, and you most likely won't be able to work a consistent part-time position, and that's just due to all the changes that are going on. And what most people tend to do is try to do some kind of contract work for themselves, where they can work as they're able to work, or in some cases people just don't work at all and try to stabilize and then try to go back to work from there. So you just, that's one of those you got to kind of work. But either way, the condition has to be dealt with, because if you don't deal with it, you will find yourself, you could very well check out. It could take you out if it's not dealt with. And when you do work, again, that energy level, you're staying constantly tired. Your work performance is, it decreases significantly. And there's a strong need for a sit-down job with but you have to have the accommodation of frequent mobility. So a job that permits you to be seated, kind of a desk job, but you have to be able to get up and move. Because if you sit for more than 15, 20, 30 minutes, depending on what your number of minutes is, you will stiffen up, you will lock up. And then when you try to move, you're stuck. And it's painful to unstick yourself. And then the sex hormones or female issues. In women, there's a failure to ovulate at times. Your cycles will become irregular. If they were regular before, they will most likely become irregular under the hypo condition. So that may be frequency, that may be the flow, that may be duration, but there will be some change in your cycle. And then once your cycle stabilizes back out, again, that's another one of those symptoms I personally use to let me know, okay, I'm getting a little off here, or I'm closer back to normal. And again, the PMS could be worse. You're moodier. You may have real pain, almost like endometriosis type of pain during your cycles. There may be some difficulty or actual inability to get pregnant or even to sustain a pregnancy. And when I did the series on the actual endocrine system, for those of you who saw that, there were the 9 endocrine glands, and then there's a 10th one, which was the placenta, becomes an endocrine gland during pregnancy. That is what helps to sustain the environment that the baby needs to be in. So if that's not working properly, because all of the rest of the endocrine system is not working properly, then you have trouble sustaining the pregnancies and you have a lot of miscarriages. You may have some leakage from your breast as well as urinary tract infections. No particular reason. You didn't do anything different. You're not wiping, back to front. You're not in the bathtub with a whole bunch of different cheap brand chemicals or perfumes and bath salts and things like that. But the bacteria in your body is not flushing through. It's not getting where it needs to go, or it may actually have leaked out, through the barrier in your stomach into your gut, and therefore out of your gut, and is floating around in your body. Immune function. You tend to get more colds, and I wouldn't say flus, but colds or any infection that's floating near you is coming to you. You've got a low resistance to anything, and when you do get it, it's oftentimes very bad, and it'll take almost forever to recover from it. You could have a cold, and most people, within a week or so, they're back to normal. No, you get a cold, and you're dealing with that thing for 3-4 weeks. You'll have recurring viral or bacterial infections or illnesses. Just, again, anything in the area it's like you're a magnet for it. Recurring sore throats, again, another reason why the people who deal with this particular issue will have hoarseness or deeper voices because their throat tends to be sore. I personally picked up the habit of just eating ice. And actually it's not so bad because I'm able to stay hydrated and keep fluids going pretty much all the time at a slow, kind of like a slow drip type of thing, instead of just drinking the water down. That was something that I picked up. You're going to have a lot of sinus infections. A lot of sinus, almost chronic. It's like forever sinus infections. So you're on point trying to keep that up. As your sinus infections go to decrease, you're getting your levels back. Some people have persistent or recurring candida, and again, women, that's the yeast infection thing. So you have to be mindful of that. Back to the tightness in the throat, swollen lymph glands. These guys will swell. I remember they swole on me one time. The first time I realized they were swollen, and I was taking my medicine and I'm doing everything. I knew I wasn't right, but I didn't know it was pertaining to this. And I woke up one day and I had these big knots on the side of my throat, just up under my chin, well, the side a little bit. Rushed to the doctor, and I just knew it was some tumor or something. I said, what else can go wrong? And thankfully, it was just swollen lymph glands. A lot of inflammation, just everywhere, inflammation. So, other conditions. And that's not to say that these conditions are caused by hypothyroidism in you, but this information, the people in my different thyroid groups, as we began looking at how to help ourselves, and we listed all of our symptoms that we were all experiencing. The symptoms that I have here are those that either I personally experienced or a large percentage of my group members experienced. Excuse me. Asthma. You wind up with breathing issues. Excuse me. Excuse me. Dysautonomia. Excuse me. See, look, my throat is trying to act up. I've been talking too long. But your nervous system, your autonomic nervous system, tends to become overactive. So you breathe a lot more. That's your heartbeat, that increased heartbeat. You develop that restless leg syndrome to where your legs are just moving a lot, just especially when you lay down. They're like jittery, if you will, or jumpy. The hypoglycemia, that's a low blood sugar. Remember, the pancreas is part of the endocrine system. If your thyroid's off, your pancreas at some point is going to be off. Those low stomach acids we talked about in part 1 will help you develop that lactose intolerance. You develop allergies. You become allergic to so much stuff. And again, why is that? Because your fighter cells are not being produced the way they should, and so they're not in position to handle what needs to be handled to deal with various pathogens or elements that your body comes in contact with. The dysphagia, your nerve damage in your throat makes it hard to swallow. And it's not just swallowing heavy like food, but that's just swallowing your fluids, swallowing your saliva. And again, that goiter or anxiety can also cause that, but that'll help to have that raspy, hoarse voice. The neurogenic bladder, that's the urine frequencies, urgencies, leakage, the chronic fatigue. It's a catch-all. They give it to everybody just because they don't want to deal with trying to get your levels right, so they just say you got chronic fatigue. Now again, these are for those who have conditions that are not being properly treated or they're being undertreated. And then you wind up with a fatty liver, developing a lot of inflammation there, and this can be very, very serious. So again, that's not to say that if you have these conditions, they're a result of your hypothyroidism, but oftentimes it is, and oftentimes once you get your thyroid back to a better level, your thyroid function back to a better level, a lot of these things either go away or they diminish enough to the point where they're not such a major issue for you. And then some other miscellaneous ones, motion sickness or general nausea, just generally nausea. You don't have to be moving anywhere. Tend to be a little clumsy. In addition to the fluid on the ears and the dizziness and the vertigo, you're not quite walking right. You're bumping into stuff. Any other conditions that you may have will worsen. And this was something that I dealt with that never really got back right. My handwriting became I'm worse than a 2-year-old when it comes to writing. I'll do good for about 5 minutes. After that, it's gone. It's awful. So I tend to do a lot of typing. Just because trying to write anything, you won't understand what I'm writing after, a couple lines. If you had varicose veins, they're probably going to worsen. That's that cardiovascular we mentioned. The tailbone pain, that's in that lower back. Your derriere, your booty, your butt, your posterior those cheeks tend to stay cold. And that's considered an extremity, just like your fingers and your toes. Your body doesn't see them as a priority to maintain the blood circulation. So they get the blood last, and that's why they stay cold. You tend to be lightheaded quite a bit. You just feel sick. That breathlessness, that's that air hunger I mentioned previously, and just generally overall struggling just to do day-to-day life. Actually, an underactive and poorly treated hypothyroid, besides being potentially fatal if you're dealing with heart issues or you wind up with a blood clot or strokes and stuff, it can make your life miserable. And then if you have one of the coexisting conditions that were mentioned here, if you have one of these coexisting conditions, then you're in for a ride. You're in for a ride, and it tends to take over your mind almost, which is why I recommend that you always have support, and you build your team of doctors to help you. So, some of the takeaways. I'm going to wrap this up. If you have thyroid diagnosis of any kind, hypo, hyper, autoimmune, secondary to some other condition, oftentimes some other endocrine issue, you become intimately familiar with your body. And that's not a sexual intimate. That is a detailed intimate. That's a know every nook and cranny of your body. Every time your body sneezes, you should be able to know how it's going to sneeze, how long the sneeze is going to last, how loud it's going to be. You've got to know everything. And you will forget, but you keep a notebook and write it down. Because when you get to the doctor, you want to be able to tell them what your different symptoms are and then be able to show the pattern of the symptoms. But the symptoms in these slides are to help you manage your condition along with your medical team. Remember, I personally recommend someone naturopathic, osteopathic, or holistic. Or if you can find an MD that has, if you can find one of those naturopathics, osteopath, or holistic practitioner that also has an MD license or certification, then you have the best of both worlds. You've got the naturopathic side, the holistic side, and then you have the Western medicine side, because there will be some need, especially for testing and stuff like that, to use the MD for any lab tests that your insurance might cover. More takeaways. There's going to be a specialist in just about every area of medicine. As we've gone through this slide, we see just about every function in the body, every part in the body is affected. And so, because they tend to compartmentalize, the MDs, the white coats, they're going to send you to a specialist for each. You're going to have a lung doctor, you're going to have a heart doctor, you're going to have the cardiovascular doctor, you're going to have a gastrointestinal stomach doctor. If you're female, you're going to have your GYN. Then there'll obviously be a psychologist or psychiatrist they'll try to send you to. There'll be podiatrists. There'll be a doctor for every single thing. So you have to oversee your medical care and this team. They're not going to talk to each other. So you and your support system are going to have to be the ones to keep up with all the information and make sure it gets shared across the board. Or make sure that what one doctor is doing is not countering what the other doctor is doing. I've experienced that, and I've seen others experience it as well. Well, one doctor says it's this, and so he gives you a medicine, and that throws off what the other doctor has you doing. And so that kind of keeps you in a loop. You're in a forever cycle and never getting better. Support is critical. It is critical. You cannot do this alone. I tell everybody you cannot do it alone. I didn't have a lot of support initially. I was able to get some support after my second go-round of nuclear medicine. The first go-round, I didn't have a lot of support. Or it's anywhere near what I needed. And so it was difficult. By the second time, it was difficult just because the condition had progressed. I thought that I was doing what I was supposed to do. And I was, but what the white coats were telling me was not getting me better. It was making me worse. And so I was able to get some support, and that was critical. It's very critical. And here again, I recommend a therapist, because a therapist can, if you had one in your Rolodex, you're going to need them. If you didn't have one, you might want to get one, because you're going to need them to help you make sense of all of this and to help keep you grounded, if you will. Someplace to dump safely, who's not going to, if you're ready to, scream at the top of your lungs at the top of the Empire State Building today, they're not going to want to have you committed, because they'll understand what you're going through, and they're just going to hear you out and let you vent and do it in a safe place where the wrong person might hear you and take it the wrong way. Finally, stop accepting one or two diagnoses and assume that's it. You push. If the next one says tap into your faith or your spirituality. If it does not align with your spirit, whatever they are saying to you, if it does not align, you keep pushing and pushing until it does. If something just doesn't seem right, they've given you this diagnosis, that diagnosis, and you still having a lot of these symptoms, or it's not sitting right with you, you keep pushing and change doctors if you have to until you get to where things are aligning with your spirit. I recommend people stop focusing or allowing other people to focus on the mental and anxiety symptoms. That's going to come. Actually, it's going to come with any major medical condition, but definitely with thyroid issues. Correct people. If they think people like to laugh and say, oh, so-and-so's bipolar. No, correct them. No, I'm not bipolar. You can tell them if you want to or not. I have a particular medical condition, and it causes fluctuation in the mood. That's it, period. Make it a teaching moment for them. And I know you've heard me mention support groups. I tend to, one thing I personally did was seek out support groups for every condition that I was given. I found a support group. And therefore, I was able to get a whole lot of information for that particular condition. And I was able to rule out what was actually related to, if there was anything related to that condition, or if it was really thyroid related. Most of it I was able to rule out. But I was also able to get tips on how to manage it while I was dealing with those symptoms as well. So those support groups for each condition they try to diagnose you with can be a whole wealth of information all by itself. And then finally, I say this for anyone that I'm talking to medically. Let's stop throwing away people. Let's stop labeling them or belittling them because they have a condition that they probably didn't ask for. I know you didn't ask for this. If you're dealing with these things, you didn't ask for this condition. You're probably not being treated properly for it. And it doesn't do you well when people throw you away, they cast you aside, they label you, or they belittle you or something. What you have is a hidden disability. And people that don't know you won't know how to handle it if they've not been educated on it, and they will label you. So again, make it a teaching moment. But don't allow yourself to fall for it. Don't allow your self-esteem to fall. And it's going to fall. It is going to fall. But don't allow it to tank and just stay there. You definitely want to treat these people with the same amount of compassion that you would someone that has a visible disability or visible health condition with cancer, leukemia, multiple sclerosis, or any other visible condition. And I say this to everyone: stop expecting people with these hidden, especially hidden disabilities, to do everything like normal, because they can't. Stop expecting yourself, and this is someplace you have to get to be able to do everything like normal. Because truth is, your puzzle piece has now changed shape. It still fits in your puzzle, but you've got to change the shape, move it around a little bit before it can fit. So it's not going to go in the way it used to go in. Even if you feel good, look good one day, overexerting yourself can put you right back into a flare-up. So you definitely want to be careful with it. And I think that's about all I have for this particular series. And I say again, I don't give specific treatments because I'm not a physician, but on a private one-on-one, I can tell you what I went through and some of the medicines that I took and some of the things that I did to get mine back in line. And then I do plan to upload. I've actually done it. I've got to make some edits to it. My particular journey going from going from healthy, I thought I was healthy, to a hyper diagnosis, through 2 series of various treatments and nuclear medicines, into permanent hypo with a hyper underlying force going there as well. So hopefully this has been beneficial. Feel free to put any comments or any questions. If you have specific health issues, just maybe drop your email or a way that I can contact you offline. I definitely would not want to talk about your specific health in such a public format, and we can do that by email. And then hopefully it'll be a benefit to you. That being the case, you take care, be blessed, and again, work these puzzle pieces. Look at these symptoms. If they apply to you, if you're dealing with it, like I said very clearly, if you are taking certain medicines and the doctor is saying to you, you are fine, according to a lab report or according to what the doctor says you should be, and you're having too many of these symptoms or you don't feel fine, either they listen to you and try something different, or you get your coat, you get your purse, and you get out of there. That being the case, take care, and we will see you on the next one.